नमस्ते कार्यक्रम स्वास्थ्य संवादमा यहाँहरूलाई हार्दिक स्वागत छ। म डाक्टर सुभाष प्याकुरेल। आजको कार्यक्रममा हाम्रा विशेष अतिथि हुनुहुन्छ पब्लिक हेल्थ खास गरेर ग्लोबल हेल्थका विश्वविख्यात एक्सपर्ट युनिभर्सिटी अफ मेलबर्नका प्रोफेसर Rob Moodie. So we'd like to welcome in the show.
Thank you, Subhash.
Rob.
Thank you.
Okay, so let's open this way. Sure. What are the objectives of your visit to our country this time?
Thanks very much. I'm here to co-facilitate a workshop on leadership skills for the senior members of the Ministry of Health and Population, doing that with the World Health Organization. And it's been a real pleasure so far and a really enjoyable experience.
Okay, so you love to lead the leadership in healthcare. Okay.
Well, it's in many ways it's so interesting 'cause I've had this experience myself. Often we have doctors, and I'm a doctor, and we end up in leadership positions. Why? Because we're good doctors, not because we actually have those skills that you need to actually, organise, run, lead a large group. And those skills, I think, are the same in Australia, same in our hospitals, same in our public health. We need to start to learn, often from the business sector, about what are these leadership skills. How to manage conflict, how to manage performance, how to negotiate, how to manage one's time, how to network, how to advocate. So many of these skills we just don't learn as medical students or as doctors, and we think it's important in public health and in medical colleges as well that we start to teach these skills.
Okay, so do you think everyone in this medical profession has to have this skill, or only the certain group like who are in true leadership should have this skill?
I actually think a lot of these skills are really important for doctors generally. In other words, they're skills that you need to do your job well, not only to be in control of an organisation. And I think, if you're communicating well with patients, if you're communicating well with your colleagues, as doctors we're taught to look after our patients. We're not necessarily taught how to look after ourselves or even after our colleagues or after our team members. So it's I guess spreading these skills, making us more confident in dealing with each other. It's even in a hospital, for example. If you have in a surgical theatre and there's no psychological safety, in other words, people are too scared to speak up. So the surgeon's just about to operate on the wrong leg and the junior nurse can't say anything because she's too scared. So these are the sorts of things where, you change the nature of a workplace to make it really functional, really productive, then everybody benefits.
Okay. Rob, we want to take advantage of your presence.
Sure.
Where the world is moving towards, what's the paradigm shift in global health domain, particularly after this COVID pandemic?
It's fascinating. COVID has had such a profound effect on us as individuals, on morbidity, on sickness and death rates, but really on our health systems. Our health systems were designed, in a sense, to run normally, to run with that sort of standard level of illness and concern. But here we had this major pandemic, and we're meant to be able to handle a pandemic and keep routine systems going. And we've seen virtually in every country that those routine systems have stopped, whether it's cancer screening or TB screening or HIV testing or outpatient visits or mental health visits. All of these things have been really stopped. Childhood vaccinations, maternal health services. In most countries, this has been really stopped or interrupted. And we've got to learn how to design new systems that both cope with an emergency but cope with normal routine services as well.
So what differences should be there? What new dimensions should healthcare domain adopt to overcome these issues and to become more resilient?
Yeah, it's a really good point. First of all, we have to do better what they call scenario planning about what's the next major problem. Is it another variant of COVID? Is it? Obviously here you've had major problems with dramatic problems with physical issues like earthquakes, and those happening now, and increasingly in my countries, it's bushfires, it's floods, and also certainly to a certain extent some earthquakes. But those big issues that we need to have a system that deals with those big issues, those emergencies, as well as maintaining a level of service provision that we need to. And I mean, we have learnt quite a bit from COVID as well. I think, we now have a new system where suddenly we've gone online. Now everybody's used to being online. We don't want to be online all the time, but we have that now in our armamentarium. So, for example, we can now have telemedicine in a way that we've never been able to use it before.
Okay.
Whether that's a family practitioner visit, whether it's a health worker visit online, whether it's particularly in a psychologist or a psychiatrist, because mental health, and I know there've been profound mental health problems in Nepal because of the COVID, then that's something that we can now utilise. We were never going to utilise beforehand.
And is there some difference speculated in the governance side as well?
Well, I think, it's quite interesting. Now we can have telemedicine, but we can also have telecoordination.
Telecoordination.
You have the three systems in Nepal.
Okay.
Okay. Well, let's make sure that people are talking to each other and coordinating services, because you've got a system that's designed to literally cross mountains as it is in Nepal. That's never been around before.
That's very interesting terminology you instilled.
Yeah. Well,
telecoordination. What can you elaborate a bit more?
Well, it's often coordination is not there because people are simply not talking to each other. They're siloed, so that one group isn't talking to the other group. So it's a matter of bringing in systems that can ensure there's a regular form of communication and planning together, so that all three levels of government, it's the same in Australia, we have federal, state and provincial level and local government level, and we don't do it very well either. And we need to get better at how do we make sure they talk to each other. Now, and obviously in Nepal you have the real issue of distance and terrain. So how can you utilise online connection to make sure that people know what the other levels are doing, and within different arms of the health service, but also different levels of the health service.
Wow, interesting. Can we learn something from the Australian healthcare system? What are the major key features of Australian healthcare system?
Well, I guess the thing that we're most proud of is what they call Medicare, which is really a universal healthcare system that I, as a taxpayer, pay for. And I think it's a wonderful contribution. I'm paying for my own health. And I know the government's then distributing that money, and it is under attack at times because healthcare is becoming more and more expensive. But the notion is we as a nation have to invest in our healthcare. We have to invest in our childcare as well. We have to invest increasingly in our aged healthcare as well. But it does take money. And we know from the Scandinavian experience, countries that invest in their own infrastructure, in their public infrastructure, public health, public education, public transport, they do the best. But they do tax at a higher level than other countries. But that's because it's a contribution. You're paying for what you get.
Is it a taxation based or premium based?
Largely it's a levy tax base that you're paying, and I really value doing that because I know I'm going to get some value back, and I'm going to be looked after when I need it, and that's the issue that often gets eroded. And saying, well, we shouldn't be taxed. We need to just get on and pay, as we can. I think it's about a social form of insurance.
What's the model of taxes? And it's the same percent in every goods or service, or it's raised taxation for the anti-health substance like alcohol and tobacco?
Well, both. There is excise taxes on tobacco, quite very high taxes on tobacco, and that's been one of the key features of actually driving down the tobacco level in Australia. Is very high taxes because it makes it expensive. But people do cut down. They then actually give up, and they can spend that money on something more effective. And on alcohol, for example, it is taxed. We have a goods and services tax for most products, and obviously a sort of pay-as-you-go taxation on your salary as well. But we're a relatively low taxing country, even though constantly our politicians and some of our media saying we're a high tax country. Well, we aren't. Again, come back to the Scandinavians. In my mind, they've got the best model, and you get the best outcomes.
Nepal is in position to reshape its healthcare system to make a concrete model later on. It has started many social health protection programs like that. In this context, what are few things Nepal should learn from Australia?
I mean, again, it's about the level of investment, I think. That's probably the key point. Okay, how important is this as a priority for the Nepalese government? And I obviously can't answer that. But the point is, it has to be taken seriously. I mean, education and health are probably, the two most important portfolios. But where do they rank in the cabinet system? In most countries, then they're not up there. But I mean, again, countries that value that, I think, do well. So that's the primary issue. Then a question of, as I mentioned before, of organisation of investment. Do you invest just in hospital systems, or do you invest in preventive systems as well? Okay. You have to do both. I mean, the point is, not just spending all your money at the end of someone's life or their, when they've got really sick. Is okay. How do we prevent people getting sick in the first place? And not only have we had COVID, but we've had these other pandemics all along, which are around tobacco, around alcohol, around junk food, really high sugar foods that really result in a major problem with premature death. There are things we have to do something about. Injuries is another issue, and obviously mental health is a big issue, where I think we can use this, as I mentioned before, teleconsultations in a way that we've never used them before, because it's not necessarily having to see someone face to face who has a mental health problem. It's being able to communicate with them, support them, listen to them, hear their story.
What's your observation regarding regulation in healthcare and maintaining the quality? How other countries have been doing? Because regulation in healthcare is a bit difficult area. It has got huge ecosystem, and regulators should be multiple.
No, it's a really, and again, I am no expert in regulation, but the point here is getting it's what they call horses for courses, right? The right level of regulation for the problem. Okay. So in other words, you don't sort of just tighten everything down and regulate it if that's not going to produce the best effect. And the point is also, if you do have regulations, then they have to be monitored and implemented. In other words, having rules in a book that no one ever follows, they're not worth having. But getting the right level of regulation for the problem, and also education. So when regulations are introduced, then there needs to be a pretty high level of education to make sure people understand, well, why? And what benefit do I get from this? And often we forget that. We just say, well, let's have the rule, here's the regulation, and we forget to explain either for healthcare systems or for people and to the public, and say, well, this is why we're doing it.
Okay, as you are here to instill leadership in our healthcare leaders, policymakers, people love to know something about you, some personal introduction and professional journey both.
Well, I was trained as a doctor. I then went and worked in refugee camps in Eastern Sudan and Africa, came back and worked in Central Australia, right in the middle of Australia, with an Indigenous Aboriginal healthcare service. So I really learnt a lot from being a doctor in the community, and I always respect that enormous privilege that I was given, literally to be able to enter people's homes and see how they live and learn from them. And that's when AIDS came along. And I worked in AIDS for about 15 years with the WHO's global program on AIDS in Africa, a number of different countries in Africa, with UNAIDS when that started. And then I came back to Australia and worked for a group called the Victorian Health Promotion Foundation. Now this is a really interesting organisation because it was based on a tax on tobacco. So you tax tobacco and then you use that money to invest in health promotion. And so you take out, because at that stage all the tobacco companies were sponsoring football clubs, music societies, and you buy that out. So you replace tobacco sponsorship with quit with a quit program.
Yeah, I know you stand firmly against tobacco and alcohol,
Absolutely.
even junk food.
Yeah.
How difficult it is to endure that counter force or...
Yeah, well, I mean, tobacco companies are very nasty, I can tell you. And, they will do anything to sell a product that kills people. If they sell a product, they promote it, and they know it kills people, and they know it addicts people as well. And, something like 2/3 of people who smoke will end up dying prematurely from them. So, that's something that we have to be careful. So the point is, I don't believe in banning it at all, but I do believe in regulating it and educating it. Same with alcohol, with junk food. How do we regulate it in a way that really can help us be healthier? And they can still make. I mean, tobacco companies, no, they shouldn't be making money. They should. I don't think they should. They should eventually go out of business. But obviously, alcohol and food, that's going to be in our lives for a very long. Well, food forever, and probably alcohol forever. But that's okay. But the point is, how do they make a profit, but at a profit that doesn't really damage people's health? And we've got to start to look at new models. It's a bit like finding the renewable energy equivalent in food. Okay, what's something where they can still make lots of money, but also can make us healthy at the same time?
Okay, you are here in Nepal for the 4th time.
For the 4th time, yeah.
So, what are the things that enticed you much by our country?
Well, I mean, the people. I mean, where I was lucky enough to have a number of Nepalese students in our Master of Public Health. I mean, Krishna Padel is one, and Niraj Shrestha, other really wonderful doctors and health professionals for whom I and my colleagues in Melbourne have enormous respect for. When we had this opportunity of working with WHO in Nepal, we jumped at it, and we're extremely grateful for what we can learn as well. Because, I mean, again, you have some really fascinating, really skilled leaders here that we can learn from.
Nature, culture, adventure.
Exactly. Well, and obviously the first time I was here as a medical student, trekking up in the Langtang Valley and going to Pokhara, so many people, I'm just coming to Nepal this time, said, that's on my bucket list.
Trekking is one of your hobbies, and what are the rest?
Oh well, I mean, music is a hobby. One of the things I learnt from here when I came here is I was in Nepal, and then I came back down to Raksal, went to Gaya and Bodh Gaya, and that's why I learnt about meditation. And I've been a meditator for 45 years because of my visit to Nepal.
45 years.
45.
So it's the Nepal that triggered you, stimulated.
Yeah. So for that, I'm most grateful.
Okay. Anything you want to add, take home message through this interview?
I think, you were just asking about, how do you manage, tobacco companies and the pressure of these large multinational corporations. And remember that corporations across the globe are now enormous. Of the world's 100 largest economies, 75 are corporations. I mean, Walmart in the US makes more money than my country. So the point is, how do we deal with their enormous pressure? Is that we network, so that the Nepali tobacco control people need to be working with their colleagues internationally. And same in those other areas. And this notion of international collaboration and solidarity, I think, is really important.
Well, we could discuss many important things.
We could.
Thank you for being with us here today.
It's a pleasure.
हस् यहाँहरू सबैलाई हामीसँगै रहनु भएकोमा धन्यवाद.